Thursday, everyone. Hi, doctor. How are you?
Good. How are you?
This is another session of Ask Dr. Jeff, so you can put your questions here, and we have some of your questions here too. And we're gonna start with you, Gina. Can you lipo the bra line on the side when doing a breast lift?
Absolutely, that's a great question. All right, so that often gives us a much better contour area up here, and also extending laterally. That gives the breast a much better contour and gives flattening on we call it the lateral chest, or the bra line, or the axilla. And that area is actually done very commonly. So the answer to that is yes.
Who's a good candidate for that procedure?
Well, somebody who, with the arms down, you see there's a little bit of fullness here.
Oh.
All right, and also along the side.
Oh, I see.
So when you see that fullness, that's still going to remain. Depending on the situation, patients have extra skin, that sort of thing. Some of that skin is recruited, is used during the breast lift. So I'll improve a portion of that. But if there's fatty tissue there, that's not going to go anywhere unless you do liposuction. So the combination, it works out great when you do it in conjunction with the breast lift without an implant.
I've seen patients, especially like weight loss patients, bariatric patients. Sometimes they have like a side boob. Is something that you can fix with that, or they need a lift?
Well, there is. I mean, basically, if they have that side fullness of liposuction, but that might leave them with more skin. And then it was last week we did a lateral chest lift.
Oh, wow.
So that's kind of like taking the incision underneath the breast and extending it to the side of the chest.
Oh, wow.
So you're gonna have a scar there, obviously.
Yeah.
And you have to decide, is the scar a good price to pay? And in some cases, it might be. In her case, it was. So we have that scar on the side of the chest, but all that fullness is gone. So that actually worked out very well. Yeah,
wow.
So we could do that, sure.
So how long can be the scar? Because I've seen I'm actually talking to a patient and she's very severe.
It could be that big.
Okay.
It depends on however long
the
skin
is needed.
Whatever's needed, right?
Got it.
Like the difference between a standard tummy tuck and an extended tummy tuck, right? So I tell patients, if we make the incision just this big, this wide, how are we going to remove skin to the left and right of that?
Correct.
Right. So same thing. So we can go out as far as we need to. That's a great question.
Beautiful. Okay, and then we have Katrina Rich, 2018. What is the highest your BMI can be for lipo 360 BBL?
Well, typically for any procedure, especially when we're laying a patient flat, on their face down, is 38. Okay, so that's pretty significant. All right, we do 38. We've never had an issue doing that. Make sure everybody's screened before that, so it's not just the 38, right?
Yes.
It's also any other medical conditions, any other comorbidities, any other factors that might give us an issue with anesthesia or recovery. So 38 is really the upper limit of that.
I have a comment here, Gucci Devs. You did my tummy tuck and BBL and am in love.
Okay,
all
great.
the way from Boston, Massachusetts, and a little hearts.
That's great, from Boston. And I was out there for a bunch of years. I was the chairman of plastic surgery out in Boston, so I love that city, and I'm glad to hear that feedback.
Beautiful. Let me see. Cardi Soye, precautions protocol for liposuction if the patient has sleep apnea.
Well, we're going to get a clearance for the sleep apnea, right? Because we could have issues after the anesthesia. We're not going to have issues while they're sleeping, here with us under anesthesia. But the bigger concern is what happens after the anesthesia, right? So we want to get clearance for that. We want to make sure that they don't have a very high BMI that we'd have to control. Make sure there were no other medical issues, because sleep apnea is often associated with other types of problems. It could be cardiac problems, could be a number of different things. So we want to make sure that there's nothing that's not diagnosed that we want to address before we do any procedure.
What is considered sleep apnea?
Well, basically, patients will, fall asleep and stop breathing.
Oh, wow.
For an extended, not permanently, hopefully, but for an extended period of time.
Wow.
So they're sleeping and then they just stop breathing. And it relates to the airway. It's all about the airway. They may have a narrow airway. They may have a tongue that falls back, onto the airways. There's a whole lecture.
Dangerous.
It can be dangerous.
Wow.
People can die from that. So, but they shouldn't, right? So if that's the case, we'd want to get a sleep study. We'd want to evaluate that at a sleep center. Usually it's an ear, nose, and throat doctor, an ENT doctor that oversees sleep apnea patients and treats them. So if that's a real problem, we also have a sleep apnea index. Like everybody got an index for everything, right? So it tells us how severe the sleep apnea is. All right, like how many times in an hour you might stop breathing.
Oh, wow.
All right, how long you're awake and running around. but when you're sleeping. So right, sleep apnea. So you're sleeping, and apnea is absence of breath. So you've stopped breathing. So that that's a problem, right? So we want to make sure that after surgery, when you still have anesthesia on board, even though you've been awakened and you're in recovery, now you're home, you still have anesthesia on board for it could be 24 hours, right?
Yes.
So we don't want those medications to have an additive effect with your sleep apnea and cause that to become a bigger problem.
Pernia Carla, the best doctor, will soon have his hands on me again to do another little touch up.
All right.
She's sending like some hearts.
Come on in.
Okay, Shayla Official, send me your name and your phone number, a screenshot of this, please. Okay.
You look great. I said somebody said I need to look great. Well, come on down. I'll do my best.
Okay. I want to get my breast done. What is this? Okay, got it. I need to look great for next year. Beautiful. So send me your name, your phone number, and then a screenshot of this live session, please. Okay, doctor. So another question about BBLs. Like, how long should I stay in Miami for?
Well, I mean, typically several days, probably around 5 days. All right. I mean, the recovery is not significant, but it gives us the opportunity to have you come in and do a couple lymphatic massages, right? So we get that going. We see how you're you're coming along in the early post-op period. So probably around 5 days.
Beautiful. Okay. I have this for now. Okay. Thank you, doctor. One more advice for the people that is thinking about having surgery, like people that is afraid of the incision of a tummy tuck, for example. Any advice?
Well, people who are afraid of incisions, sure, everybody's always afraid of incisions, especially breasts, which might be more visible, but these heal very well, all right? The tummy tuck incision, we very rarely have anybody afterwards say, oh, I hate the incision, because the improvement is so dramatic, so the incisions are not usually an issue, but how do we minimize, typically we're going to have normal scarring ideally, but how do we improve that beyond the normal phase? So we do a couple things. So starting at 2 weeks after surgery, I like to have the incisions massaged with vitamin E, the cream, not the oil. I don't use any oils. So it's a white stuff, white cream, vitamin E, and also silicone sheet, silicone tape. So we apply that, and these things work by different mechanisms. The massage itself is very helpful for laying down the collagen more flat, more organized. You can see this under a microscope, actually.
Wow.
And the silicone does a number of things. It keeps the scar hydrated, it improves the pinkness, and helps it resolve more quickly, gives us flatter incisions. So if you're really, that person who's concerned about scars and incisions and that sort of thing, and their ultimate appearance, massaging them twice a day is super helpful.
Nice.
And the fadeaway is my preferred product for that. Fadeaway. Fadeaway scar sheeting, and they also have a product that's the gel. So you can also use silicone gel and just massage it right in. You can use vitamin E, you can use silicone, you can use them both.
You can get it on Amazon.
You can get it on Amazon, right? So these are really good products, and there are many of them out there, but these are all good products that help scarring. So if you're concerned about that, that's what you do. The other thing I would say, regardless of your skin tone, is avoid the sun, right, for a year, basically. So you could wear, the incision should be below your swimsuit, right? That's how we do them. So that's going to be invisible. You're probably not topless at the beach, but if you are, I would go with, major sunblock.
Yeah, because the sun can cause an impact on that.
It can cause an impact for sure. It can cause hyperpigmentation. All right, so you can end up with darker scars, and whether you're light skinned or dark skinned, nobody wants a darker scar.
And it goes with the little incisions for the BBL, too, right?
Yep. For the BBL and liposuction that we do with the BBL or by itself, these are very small incisions. These are like 1/4 of an inch. They're tiny, but you don't want a dark mark here or dark. You don't want these dark little marks. So. You can use silicone sheeting there as well, but they're so easy to massage. When you're at a stop sign or a red light, you just massage it. But it's so easy to do.
Netflix.
Watching Netflix, that sort of thing. These things take like minutes a day out of your life, but you'll have a better scar, for the rest of your life. So it's definitely advisable. You have time for one more question if you have one.
Yeah.
So, but scar management is a really important thing after surgery, of course.
How long should the drain stay after a tummy tuck?
Another great question. So for me, 2 weeks. All right. So I like to keep them in 2 weeks. I've been doing this for many years, and at that time point, I feel that you have a sufficient amount of time to minimize the likelihood of developing a collection we don't want, which could become infected, right? But we've allowed the flap to sit down. That small bit of suction we get from the drain removes the fluid, but also it helps the flap kind of stay down early on, because we've lifted the whole thing, we've put it back down, but now in that 2-week period, you've got new blood vessels that are growing into that flap, right? It's called neoangiogenesis and neovascularization. We've got new cells and new vessels growing into that flap. So I like that 2-week period. So why not do it for a month? Well, then if you do it beyond 2 weeks, then you start to have the potential risk of infection at that point. So for me, it works out great. I think 2 weeks works out well, and patients will say, oh, over the last 24 hours, I have very little bit of drainage, can I take it out? It's been a week, and the answer is no, because it's not all about the drainage, okay? So it's, for me, it's 2 weeks. Can we cheat a day? Yes, we can cheat a day, but not more than that. So the answer is 2 weeks.
Awesome. Well, thank you, everyone. Thank you for being here, and thank you,
thanks
Doctor.
for joining us. Thank you, Lily, and we will see you next week.
Next week. Bye.